Hiya and howdy. This video is going to be about my personal experience with the differences between doctor's appointments in the US and the UK. The reason why I'm not filming this in my home is that my home is currently being torn up and put back together by contractors. We have a rising damp problem here in our flat in Cheltenham, and it's just a noisy, chaotic mess right now. So we are out in the beautiful countryside in between Toddington and Broadway right now, and Ian is working on getting some drone photography. So I'm going to talk to you about doctors. If you're new to my channel, hi, I'm Dara, an American Anglophile, married to my husband Ian, a dual citizen. And we live here in Cheltenham, Gloucestershire, half the year about, and in Texas the rest of the year. Here on my channel, I talk about the differences between British and American culture and share all of our British adventures with you. And today we're going to talk about doctor's appointments. Now, to be clear, I'm not going to talk about the NHS today because so far I still haven't used the NHS. I have obviously used private insurance and seen the doctor many times in my long life in the US, and in the past few years I've gone to the doctor here in the UK, also paying privately. So that's what I'm going to compare today. Although in an upcoming video I will be talking about the NHS because yesterday Ian and I both went to our local surgery and registered with the GP, or rather we started that registration process. So stay tuned for an upcoming video where I talk about our experience with the NHS, and also stay tuned for the video about the steam train here in Gloucestershire, Warwickshire, because that's what Ian's shooting the drone photography for right now. So without further ado, let's talk about doctor's appointments. As I share my experience, I'd love to hear how your experience differs. If you're American, how it differs in the States, and if you're British, how it differs versus what your experience has been with the NHS. Here's the situation. I have bone density issues, and I have for many years. I've been having that treated in the US by various doctors, starting with my gynecologist when I was identified as having bone density issues far too young, and then following up with various other doctors like general practitioners, orthopedic surgeons, etc. And really, the person who prescribed my drugs was an endocrinologist, which is a little bit strange because they mostly work with people with diabetes, but that's who I was told to go to in the US. And I was put on some expensive drugs. One is an injection that you get twice a year, and each jab costs about $1,400 if you don't have insurance. And even with insurance, only a tiny portion of that is covered. So it's incredibly expensive. And with me being here for 5 months of the year, I was having trouble getting both of those injections in the US. So I decided this is the year I was going to sort out how I get things taken care of here as well. That's when the whole odyssey started. Let's start with the process of finding a doctor. I live in the Dallas, Texas area when I'm in the States, and that is one of the largest major metropolitan areas in the US. But I found it really difficult to find a doctor who was an expert in bone mineral issues and bone mineral disease to help me with my osteoporosis issue. I kept getting punted around from doctor to doctor. The only time I saw a doctor who was really willing to sit there and look at my medical history and my records and give me a recommendation based on the latest current research was a doctor at a teaching hospital in Dallas called UT Southwestern. He was a specialist and researcher in bone mineral issues. So I did meet with him many years ago, and he was fantastic. He took the time to go through my records. He gave me his recommendations on my treatment plan and what medications I should be on. And I have gone off of that recommendation for the subsequent years. However, shortly after I met with him, I got a letter from his practice saying that he was no longer seeing patients and he was just going back to researching and teaching. So I've never been able to go back to him and follow up. Therefore, I've had no continuity of care. And the other doctors I've seen have really just relied on what the other guy said rather than having any knowledge of their own. In contrast, when I decided to go see a bone doctor here in the UK, I was told to see a rheumatologist, which makes sense, and I don't know why rheumatologists in the US wouldn't see me, but I just called up the Cheltenham Hospital, where you can use private insurance or pay cash, made an appointment, was able to get an appointment with a specialist who knows all about bone mineral issues the next week. When you're making an appointment in the US, often you'll call around to a bunch of doctors and you'll be told, that doctor's not accepting new patients. That doctor doesn't have an appointment for 2 months. All the good doctors are either not accepting new patients or you have to wait a couple months to actually get an appointment. When I have used private insurance here in the UK, I've been able to get an appointment very quickly. And also the hours are so much better. A lot of doctors don't work at all on Fridays and have pretty short hours in the US. But I was seen a couple years back for a different problem at 6:30 at night. I'm like, what doctor has appointments at 6:30 in the evening? British doctors, that's who. Just a little more customer focused in their approach to patient care. Now let's talk about what happens when you arrive at the doctor's office and wait in the waiting room. In the US, even if you have scheduled an appointment for, say, 2 o'clock, you've got to show up at 1:30 because they're going to make you fill out a bunch of forms. Even if you try to fill out forms in advance and bring them in, they still make you come early to fill out all these additional forms. Then, if your appointment's at 2 o'clock, you will often wait till 2:30, 2:45, even an hour, 3 o'clock, to have the nurse come back and collect you from the waiting room. As opposed to when I went to the doctor here in England, I was collected exactly on time for when my appointment was by the doctor. No intermediary going through a nurse or PA or whatever. The doctor himself came and collected me right on time from the waiting room. And also, the waiting room had tea and biscuits. Now let's talk about what happens when you get back to the exam room. In the US, the doctors are such a higher life form, they don't really spend very much time with you. So first, you will be seen by a nurse practitioner, a PA, and they will interrogate you and ask you all these questions. So even though you've already filled out a ton of forms, they won't look at those. They'll still ask you all the pertinent questions again. Then, after a certain amount of time, you might wait another 15 minutes or so, then the doctor, him or herself, will appear and see you in person. And you know what? They'll ask you all the same questions again because they haven't looked at all the paperwork that you submitted in advance. It's a little annoying. And the visit is always very brief because the doctor's time is too valuable to spend very much with you. So they will just hear your problem, do a quick physical exam, and then tell you their verdict, give you the prescriptions that they want you to take, give you instructions on what you should do, and then be out the door. It's rare that I see a doctor for longer than 10 minutes, maybe 15. Whereas in the UK, I always see the doctor right away, and he really spends time with me. When I saw that doctor about my bone mineral issues, I had submitted all kinds of records electronically in advance via email. He had printed out all those records. He'd gone through them in detail. He discussed them with me in detail in an unhurried manner, and he spent a lot of time with me. I think I might have been in his office for 45 minutes. He really wanted to understand my situation and make sure he was giving me the best advice going forward, which I really appreciated. Now let's talk for a minute about the approach to medication and the use of prescription drugs. I know that American doctors have a bad reputation for just prescribing drugs all the time, but it's kind of true. I really have felt in my 30 plus years of coming to the UK that the approach to medicine has been more conservative when it comes to using prescription drugs. And even when I was a mom of very small children, both of my boys had ear infections all the time. And in the US, the doctor just prescribes antibiotics over and over and over again, even if your child is getting ear infections every few months. Whereas in the UK, that's not the first course of action. There's other types of things that they try, more natural remedies or conservative or preventative approaches, rather than just the overuse of antibiotics and other medications. So I was surprised but not surprised when the doctor here, looking at all of my history and all of my test results, said, I don't think you need to be on that $1,400 injection that you were getting twice a year. So I recommend you stop doing that. Thankfully, I'd only had a couple injections, so it was okay for me to stop. The other interesting point is, even if I had chosen to get that injection, it would have cost a fraction of the amount. So let's talk about follow-up. I have been to dozens, if not hundreds of doctor's appointments in the US in my life. And what is typical is when the doctor's telling you what to do next, you're sitting there up on the exam table, maybe wearing some paper disposable gown, or maybe you got your shoes and socks off and you don't have a pen and paper in hand, but they just spew all these instructions at you of, you need to do this 3 times a day. And I don't like memorizing all of those instructions. I really would prefer that something would be written down. And my podiatrist is great because at least she does give me sheets that have instructions on how to do follow-up care after my office visit, but that is unusual. And I'm always having to ask doctors like, hey, can you write down all those things you just told me to do? And then they assign their nurse to do it. But at least I get instructions written down because I want to know what they said so I can follow the instructions carefully. Then contrast that to my British experience, where when I've been to the doctor in Britain, I get a written letter following up from the doctor of his diagnosis and his recommendation for care and future treatment, which I really, really appreciate. Finally, cost. Again, I'm not talking about the NHS, I'm talking about private insurance or paying by cash, and I can tell you that American healthcare is ridiculously expensive. So if I go for an initial consultation to a specialist about some situation, some medical issue I'm dealing with, it is not uncommon for me to spend $300 or $400 in that initial consultation. Contrasting that to the appointment I had with the bone mineral specialist regarding my bone density issues here, it was £225 for the appointment. Now, I think that's pretty expensive for British care, but I did not begrudge it because he spent so much time researching my problem before I got there and so much time with me while I was there. And in the end, he recommended that I stop taking these really expensive drugs that I was already having to take. So I'm saving a ton of money in the end, and I feel like I'm getting a more appropriate treatment plan. Going back to the cost of those medications, that shot, injection, jab, whatever you call it, that I was getting twice a year was $1,400 a shot. That is crazy. And even with my insurance, I just covered a portion of that, a little portion. So it was maybe $1,200 out of pocket for me to get that. Even if I had needed to continue taking that drug, here in the UK, I could have gotten that same injection for below $500. Even if you can't use the NHS, even if you don't use the NHS, it's still so much less expensive and so much better care here in Britain, in my experience. But that's just my experience. If yours has been different, let me know. I look forward to hearing from you in the comments, and stay tuned for my upcoming videos about our NHS experience. Thanks so much for watching, and do something good in the world today.